Welcome back to another episode of Skinfluence. I'm your host, Dr. Dustin Portela, board-certified dermatologist.
And I'm Austin Lee, physician assistant, who's been practicing dermatology for longer than I'd like to admit.
And we're glad to be back talking today about adult acne because there's some nuance between adult acne and teenage acne.
100%. And a lot of people wonder, why am I getting acne when I never had acne as a teenager?
And I feel like it's becoming much more common. We're seeing way more adults.
We're seeing way more adults. You're very right.
So we're going to get into why that might be, what are some of the potential causes, the unique factors that adults are, under versus teenagers, and then we'll get into some of the treatments that we use both over the counter and in the in the office that are by prescription.
Yeah.
So,
well, let's start at the beginning. Why does adult acne happen in the first place?
It's the $1 million question, and there's, I think, a lot of different reasons. One of the most common things, and it's what most patients assume, is hormones. Mm-hmm. So especially in females, when I say that we're seeing more adult acne, I think it's primarily in females. And it's often related to hormones because we see it in that pattern of hormonal acne, which is on the lower third of the face, kind of jawline, chin, neck. And oftentimes it's deep, cystic, painful lesions that just don't ever want to come to the surface.
Totally. They'll come in complaining of acne, and when you look at their face, you don't really see blackheads real often. It's more, like you said, just red, angry pimples that very often show up during the menstrual cycle, but can often show up throughout the month. It doesn't have to be directly correlated with their menstrual cycle, but there's a lot of things that can bring that on, especially later in life. Like you had mentioned, hormones play a role, and hormones change throughout our life. Something people don't really realize is about every decade, men and women go through a little bit of a hormonal change, a little hormone balancing, or whatever you want to call it, and that can elicit some acne showing up.
Perimenopause is like all the rage now, like as the cause for so many things. It's definitely trending. And I'm not saying that it's not the cause of a lot of things, but it's those times when hormones do start to shift. The menstrual periods can become a little bit irregular as you head into menopause. And then some people are even talking about menopause. Like a drop off of testosterone. And that, I think, leads us to an interesting phenomenon that's happening where we're seeing a lot of hormone clinics pop up all over the place.
Yes. People
are going in and getting hormone replacement therapy. And over the last few months, I've seen 2 women who were megadosed on testosterone accidentally and had raging acne when they came in, because women are supposed to have very low doses, low levels of testosterone in their system. And one lady was given a dose written by the clinic and filled by the pharmacy. And both times she are you sure this is the dose? This seems like a lot. And then the pharmacy said yes. She even called the clinic back and said, before I do this, is this the right dose? Because she was injecting 0.5 mLs, which is 100 milligrams of testosterone weekly, which is the dose that I've been prescribed.
Yeah.
And
this is how old are these?
This is a woman who's, in her late 40s, early 50s.
So not old.
Not old, who just wanted a little bit of testosterone and got really elevated dosing. And so when she came in, she had a deepened voice. She was growing more coarse hair, severe acne. Yeah. And it took months for that to kind of settle down. And her voice still isn't totally back to normal. Her skin is pretty much back to normal. Yeah. Another patient got hormone pellets inserted. Yep. And the hormone pellets that included testosterone shot her testosterone levels up to way supratherapeutic levels. Yeah. And she just broke out with terrible acne. We're also seeing guys get into testosterone replacement therapy way more often.
And earlier on in life.
Which I think there's some serious issues with if, you think about your fertility and everything. Yeah. But we're seeing a lot more acne. I've treated so many more guys recently with Accutane who are on gear, so to speak, whether it's legal testosterone that they got a prescription for or they're getting it from their buddy at the gym or whatever it is. But so hormones, I think, are the main driver of this resurgence of adult acne. Yeah. There's also other factors, though. Stress, cortisol levels, diet.
Those all play a role. So what those do, so testosterone, like we're talking about the hormones, when you're under a lot of stress, you're creating a lot of cortisol. That cortisol is pro-inflammatory. You're going to be way more prone to inflammation in the skin and throughout the body.
Yeah.
But it also acts, down the pathway. It'll act on the sebocytes or the sebaceous glands, the oil-producing parts of our skin, to start stimulating and producing more oils. That's exactly what the hormones are doing. So testosterone gets converted into DHT, dihydrotestosterone, which helps basically us make more oil. And as well, the same thing happens with stress and cortisol. It all leads to producing excess oil.
Yeah.
We talked a little bit about the distribution. We see it a lot in women, but in men who are coming in, you could always tell if they're doing testosterone because it's very often the back where they're getting a lot of the back knee, deep cystic, similar presentation, just different location.
Right.
But it's all contributing to oil production and inflammation. That's what this all leads to.
Yeah. Food is another one. We are eating more processed food than we ever have in the history of the world.
So you're saying no more Taco Bell?
No more Taco Bell.
Dang it.
The GI doctors would probably say the same thing. So processed foods that are rapidly metabolized into carbohydrates spike your insulin level. And eating late at night, those things are going to boost your cortisol, the stress hormone, and just repeating that cycle. We're also on our phones all the time, which disrupts our sleep.
Yes.
Sleep dysregulation, I think, is a huge part of it.
I think I would agree with you. Sleep dysregulation is something I bring up often, and so many people are getting horrible night's sleep or have horrible sleep routines.
Even if you think you're getting a good night's sleep, like if you're on your phone late until the moment you lay your head on the pillow, your circadian rhythm is being disrupted. And I'm guilty of this in many cases as well. And I track my sleep with an Oura Ring. I have the 8 Sleep mattress cover that tracks my sleep. And there's times when I think like, oh, that seemed like a pretty good night of sleep. And then I look at my resting heart rate, my heart rate variability, my sleep cycles, and I'm like, oh, yeah, my body didn't get the restorative rest that it really needed because I ate late, or I was on my phone late, or I was, exercised too late, whatever it is. There's a lot of different factors that play into poor sleep, and it becomes a vicious cycle, and it manifests on your skin often. But it's not just your skin, your cardiovascular system, your endocrine system, all of the other systems in your body can be suffering as well. It's just that we don't visibly see those the way that we do acne on the skin.
Yeah. So very often the skin is just a manifestation of issues going on inside, and this is definitely one of those cases.
Right. So when people are getting acne, obviously most people are going to try to treat it at home in some way.
Yeah.
And this is where some people will go awry, I think. There's mistakes that have been made, and we see the results of these in the clinic.
Yes.
Sometimes the first is that temptation to pick and pop at your pimples.
Totally.
You start mashing on them. And when these are the kinds of acne that don't like to come to a head, and you go mashing on them, they may still rupture, but rupture underneath the skin.
Exactly right.
And then you have way more inflammation and increased risk of scarring. So that is something that I would encourage people, like if you get those big pimples, put a little salicylic acid on there, put a pimple patch on there, come and see us, get a steroid injection, but avoid, really trying to go after them.
Yeah. Popping a pimple, if you pop it and it pops the wrong way, like you said, underneath the skin, it's going to elicit more inflammation. You may end up at like an urgent care because you're like, this is 10 times worse now. And now you're on antibiotics kind of unnecessarily probably. And that's hurting your gut. And it can lead to scarring, which is the worst case scenario. Now you have this big scar on the face or a little divot because you went after a pimple, and we want to try to avoid that. Another pitfall that we see people doing at home is they'll try microneedling, which is very popular right now. And microneedling over inflammatory skin is just going to make it more angry. It's going to make it more inflamed. Using the wrong type of microneedling device, if you're rolling over it, it's just going to tear the skin. So if you're struggling with this type of acne, before you start trying to do things at home, obviously washing the face, gentle hydrating cleansers, sunscreen, things like that can be fine. Niacinamides, come in and let's walk you through how we can do that.
Yeah. So we'll get into all of the treatments that are available, both over the counter and by prescription. But first, a little did you know?
All right. So you got yours ready?
Yeah, I think so.
Okay.
So Austin, did you know, I looked this up, one of the earliest documented cases of acne dates back over 4,000 years ago to ancient Egypt, where in the Ebers Papyrus, which was circa about 1550 BC, they referred to it as akut, as the diagnosis. And they often treated it with honey and animal products. Now, I don't know what animal products mean, but I'm assuming it was beef tallow.
We have to make that assumption at this point.
So beef tallow, it's been around and it's having a moment once again. But there's some other interesting things. Ancient Greece, it was documented. Ancient Rome.
Okay.
The first century physician, medical writer Celsus, documented skin conditions similar to acne and advised the use of sulfur baths, which is an ingredient we still use, like sulfur cleanses, sulfur spot treatments. There is some evidence that some mummies have had acne. So like Pharaoh Tutankhamun was believed to have possibly had acne as well. And I think he died at a pretty young age. King Tut, yeah.
Oh, that's King Tut.
Yeah, Tutankhamun.
Yeah, I've heard that he died relatively young.
Yeah.
What did the Egyptians know? That's like
they knew a lot with that, without becoming like a Joe Rogan podcast and going into ancient aliens. Like that's not the purpose of this podcast. But I think they were fairly advanced, more than we give them credit for.
A lot of our did you knows involve things that the Egyptians were doing.
Cleopatra was the early influencer when it came to beauty.
Number one. Well, my did you know is along the same lines, and it's involving acne. And did you know that the vast majority of people who get adult acne are women between 25 and the age of 40?
Yeah, that's what we see in the clinic.
And
sure.
and that tracks perfectly with what we see in clinic. And it's something that's frustrating for sure. But our next segment's going to go into treatment. So let's get into it.
So when we see people in the clinic, they've often been using many things, oftentimes pretty aggressive routines. And they find that things are getting worse. I don't know if you see that. Why do you think that is?
So very often I have this conversation on a daily basis with my patients where when they start seeing acne, the first thing they think is, my skin's dirty. And they'll want to do some sort of scrub, or they'll want to use some sort of active ingredient like benzoyl peroxide or something along those lines. And they'll either start over cleansing, they'll start scrubbing. I tell them to put the brushes away, put the scrubs away, because when you're just scrubbing over inflamed skin, you're going to make it worse. Benzoyl peroxide and salicylic acid and actives like that definitely have their place. But if you're overusing them because you think this is a dirty skin issue, then it just aggravates things. So that's one of the main things I try to talk my patients down off of that cliff. But
yeah, I've seen a lot of people who get routines that are just drying their skin out like crazy. And so they have cystic acne around the jawline, but essentially they break down their skin barrier so much, they're also now developing perioral dermatitis. And they're getting a rash around their mouth, at the corners of their nose, and they're coming in with two different problems, essentially. And thankfully, many of the treatments can overlap and we can get them better. But sometimes going, really aggressive in your home routine is not always the right approach.
Yeah.
In cases of rosacea or acne, oftentimes there is barrier dysfunction, and getting a patient on a more gentle routine with very targeted active ingredients is usually the right approach.
Totally.
Where we can repair that skin barrier, help the skin physiology to function more normally.
Yeah. And there are good over-the-counter products that can do that, as well as prescriptions that we like to use. Very often when people come in, you probably see this quite often, but their primary care doctors will put them on topical treatments to try to start helping. Commonly, what we like to see, over-the-counter niacinamides can be beneficial. Vitamin C serums, things like that can be beneficial to help repair the skin barrier, calm some of that inflammation down. But a lot of the issues are a little bit deeper. But I will often start my patients on a topical clindamycin lotion or cream. I try to avoid gels very often just because they're drying a little bit.
They can be a little more drying.
But that'll help calm down some of the inflammation as well. A lot of people, when we say we're using clindamycin, they think, I have a bacterial infection, and that's often not why we use that.
Right.
But that's one of my go-tos for people who coming in with more inflammatory type acne.
Yeah. Over the counter, a lot of salicylic acid I think can be helpful. I've seen really good results on cystic acne where you spot treat with a 2% salicylic acid. You get some of that penetration through the oil glands, through the sebum that's on the skin, and can get some of that anti-inflammatory effect. Benzoyl peroxide as a spot treatment can do a lot the same thing. And then I do think it's unappreciated, but sulfur can be an effective spot treatment.
It totally can.
Or a cleanser. I've used several different sulfur, washes or spot treatments, and they work well. It's just if they're not formulated really well, they can be quite pungent. The smell can be overpowering. And I tried a new sulfur cleanser a few weeks ago from a brand I really like, and it felt great on the skin, but the smell was so strong. And then I dried my face with my towel. I have a separate towel for my face. And then for several days that I forgot to change the towel. Like every time I would dry it, I would still smell the sulfur on the towel. I was like, I got to change this.
Yeah.
So
it's not good.
There's pros and cons to it, but it can be effective. And if you've tried a lot of over-the-counter stuff and you haven't tried sulfur, it's worth a try.
Yeah.
And then if that's not helpful, you can certainly go see a dermatologist. But those are kind of the main things that we look at from an over-the-counter perspective. And as we get into the prescriptions, you mentioned clindamycin. I like to combine that with benzoyl peroxide to limit the risk of bacterial resistance developing to the clindamycin, because bacteria can be a component of even adult acne, even if it's largely hormonally driven. And so that combo can be helpful. Retinol, I still use even in the adult population.
Yeah.
Tretinoin works fairly well in some cases.
Yeah, I agree. I typically will combine clindamycin with tretinoin. It'll help slow down the cell turnover rate, help keep the barrier as strong as possible, as well as the clindamycin is going to help try to calm down the inflammation. Those are my go-tos. I usually will start kind of a middle strength tretinoin and then work up if I have to. Do you ever really start at the 0.25?
I do
strength?
if they have some overlapping rosacea, sensitive skin, perioral dermatitis. I'll go on the lower end. Or if they've used something stronger before and then had reactions to it. The last couple of years, we've gotten a new option called Winlevi.
Yeah.
Winlevi is an aldosterone receptor antagonist. That means a hormone receptor antagonist.
Yeah.
And it is supposed to help block the hormone receptors at the oil glands. The generic name, I think, is clascoterone.
Yep, you're right.
And I think it's a good option. It does have to be used twice a day to be effective because it's got a short half-life in the skin. It's very gentle. It's not drying. It's actually a pretty moisturizing topical.
Yeah.
And I've seen some good results with it.
I've seen great results with it. Like all branded medications, it can be difficult to get approved sometimes, but I think it works really well. You avoid some of the systemic side effects of like a spironolactone, which we will probably talk about here in a minute. But Winlevi is a great topical option.
Yeah. When we can't get Winlevi covered, this is where we'll get into compounds. And compounded spironolactone can be used topically. And I do think that there's some benefit from it. I will usually have the pharmacy compound it with Dapsone, which is an old topical acne medication. It's even an oral antibiotic that we'll use for specific skin conditions, not very often because it's got some risks. But compounding Dapsone and spironolactone, I've had some good results with. The biggest challenge to compounded spironolactone is that it also has quite a smell.
Oh, really? I did not know this.
Yeah. Many people have complained about the smell, and so sometimes it's compounded with a little fragrance, and then you have to be cautious about, sensitivity issues there. But from a topical perspective, there's also a number of different retinols that are available, different versions of tretinoin, Acleef, tazarotene.
Yeah.
There's different, they hit different receptors in the skin, and some people just respond better to one versus the other.
Yeah.
So you'd mentioned spironolactone, and I think that carries us well into some of the oral medication options that we'll use for patients.
Yeah, spironolactone. So men versus women, how do we treat different things? Very often when someone comes in and they're getting that deep jawline cystic acne and they're complaining that it's definitely worse around their menstrual cycle, spironolactone is typically a go-to for me. Yeah. They're going to see good results. It's going to basically saturate those receptors that are sitting on our oil glands, so when the hormones try to attach, they just can't, and it's going to help those oil glands not produce as much oil, prevent some of the plugging and inflammation. Spironolactone, it's a pretty benign pill, fortunately, but the main side effect that we see is it makes you go to the bathroom more frequently.
Yeah.
So we definitely have to have them drink a lot of water because we don't want to lower the blood pressure. But
Yeah.
spironolactone has played a great role in a lot of my patients. And then the only issue is you have to kind of be on it for a while.
Mm-hmm.
And so it is safe to be on. There's no real long-term effects. We use a low dose of it, but spironolactone is a great option for women.
For women. It is a blood pressure medication, and it's used for acne off-label, meaning we prescribe it, but the FDA has not approved it for acne.
Mm-hmm.
And so we do, ask about blood pressure, heart arrhythmias, and it can raise the potassium a little bit. And so if you're on spironolactone, I tell patients, don't consume tons of avocados or bananas or drink tons of coconut water. If you have a fairly normal diet, it's not likely to change your potassium to wild levels. If women are over 40, oftentimes I might get the occasional basic metabolic panel just to make sure that their potassium isn't going crazy. I had a patient last year who we didn't prescribe the spironolactone, but somebody else had, and she ended up getting on a really high dose. And I don't know if there was an error from the clinic that she saw, but she had a life-threatening heart arrhythmia as a result because her potassium went really high. She was admitted to the hospital thinking she had a myocardial infarction, a heart attack.
Oh, no.
And she thought we prescribed it. She was a little mad at us, and we looked back through the chart like, no, we didn't prescribe that. Like, it's not in your medication history from us. We don't know where you got that from.
Yeah,
but we had talked about spironolactone with her, but she got it from somewhere else, and they prescribed way too high of a dose. So it's one of those things you do have to exercise some caution with. It's not safe to be on if you're planning to become pregnant. And so a woman in her late 20s, early 30s who thinks she may want to get pregnant or have another child if they already have children, it's something that we can use until they want to try to conceive because it can lead to some birth defects because of its impact on hormones. And it does make you pee more. It's a water pill. That's how it lowers your blood pressure. Yeah. So, it takes 6 to 8 weeks to really start kicking in. Yeah. Side effects often resolve after the first month or two, whether that's frequent urination, breast tenderness, spotting between your cycle. You have hormone receptors all over, and it can impact some of that. But I find that most women tolerate it quite well and become really pleased with the results after 2 to 3 months.
Yeah, I would agree with you. Another oral medication that we typically would prescribe. So if like a guy was coming in, I don't typically use spironolactone, but doxycycline, our classic doxycycline antibiotic pill that everyone loves to hear us talk about, because I always get the question, antibiotic pill, like, is that going to hurt my gut? And it's like, well, it's an antibiotic. We're prescribing a lower dose than usual, but I go through the typical precautions of take it with food, take it with, take a probiotic at the opposite time of the day and things like that. But we use it mostly for its anti-inflammatory benefits.
And I find that it works well. I never like to keep people on it for a long period of time. So it's not a permanent fix, especially if somebody is dosing testosterone on a weekly basis. They're going to get some relief with doxycycline, but as soon as we stop it, the acne is probably going to come right back. Yeah. But it is, one of the few oral medications that works really well for acne, short of Accutane.
Yep. And then the last one's Accutane.
Right. So I've taken a number of women with hormonal acne through 1, sometimes 2 courses of Accutane, and ultimately the results end up being very good. It is more stubborn than teenage acne.
Yes.
I have found. And then men who are doing testosterone replacement therapy, they have a hard time getting off of Accutane. So if their body is a hyperresponder to create acne from being on testosterone, oftentimes we'll treat them with Accutane, and then we may have to fall back on low dose Accutane where they take it 1 to 3 times a week to keep the acne from flaring up, keep them from being so oily, but not having all of the typical side effects of Accutane, like being achy or sore or having super dry skin.
Yeah. And it's a great Accutane is always a good option. For some people, it's the last resort. For some people, they just want to get through it and get rid of it. But definitely a big advocate for Accutane, especially if the acne is impacting our patients in a really negative way.
Yeah. And there is I find almost in the adult population, there's a significant, perhaps more significant than the teenage population, impact on mental health.
Yeah.
Somebody's a professional, they've got a job, they're in the public, and having significant acne can really take a toll on their self-esteem. So it's important to acknowledge that and to treat, aggressively and get that to resolve the best that we can.
Yeah. I just had a patient, was today or yesterday, or it was today or Friday, but I forget. But we started Accutane because they had severe, as an adult in her 20s. And it took a little bit of convincing that, like, this is probably the next step. We tried everything else. She was very hesitant. And she came in, I think it was today. She came in today and was asking, I don't want to stop.
Yeah.
So that's how good of an impact it had on her and how she feels about herself and how she's presenting to the public. And we talked about, it's okay to stop. Like, you've met the goal range, and we talked about how to kind of maintain your skin afterwards, but it's just kind of funny thinking back going, oh, it was hard to get you on this, actually.
Yeah. And now we can't get you off.
Yeah.
It's like taking your kids to the park. They don't want to leave the house.
Totally.
And then when you're at the park, they don't want to come home. That's how Accutane is sometimes. Like, people are resistant to go on it, and then they end up loving it.
Yep.
So, but it has, I strongly recommend you do it with a dermatologist who understands the risks, benefits, and has a lot of experience taking people through that. And we do it every day here. So when it comes to treating adult acne, it does behave different than teenage acne. And it's just important to have realistic expectations and be consistent with your treatment over a long period of time. We'll try to make it as good as we can, but there's probably still going to be times where there's flares, and it's frustrating.
Yeah, it doesn't mean it's the end. Like, there's things that we can keep doing and fighting and trying. And sometimes I've found that it takes a little bit of tweaking. There's no one size fits all treatment for every single patient. And what worked for our last patient, it may not work for you. And so it takes some time to figure out which ingredients, which products are going to sit best with your skin to help your specific case. And so when you're working with a dermatologist and you're going back and it's your second or third time and they keep trying to switch things up on you, that can be normal because we're trying to find what works best for you. Obviously, we try to start with things that work for the vast majority of our patients, but there's always some difficult cases, and you're never a guinea pig if someone's trying medications on you. Sometimes people I just feel like they're just throwing things at me. And it's our job as providers to try to explain why we're doing what we're doing. But there's unfortunately no one size fits all. You're going to flare every once in a while. But, when you're working with a dermatology professional, we can help you, know when is it time to take the next step? When is it time to add a pill, or when it's time to add Accutane or things like that? And to try to get your acne as clear as possible. Yeah.
I still occasionally deal with acne. I do low-dose Accutane periodically, and I've just kind of learned what the triggers are for me. Poor sleep, bad diet. Like, I know that if I'm traveling and I'm not sleeping well, I'll probably have acne by the time I get back.
Totally.
And so just trying to manage those potential triggers and control for them, and then treat, when I need to. And I have topical products at home. I have prescription topicals that I use periodically. I usually steal them from my wife, but we, we're people too, and still get acne, and
100%.
So I can definitely have empathy for the experience when our adult patients come in dealing with acne. So.
Yeah.
Well, as we round this out, we want to share with you guys the product of the week. We've shared it before, but it's the Mantle Skincare Set. The whole bundle is one of the least expensive bundles that we have on the website or in the clinic. Comes with a cleanser, an age defense moisturizer, and one of my favorite sunscreens, the Invisible Daily SPF. This is a clear sunscreen. It's great, particularly for men. If you have facial hair, it doesn't gunk up in the hair. I take it all the way up over my head. Kind of has a matte finish, so it's not shiny. The whole bundle is $30. The sunscreen is $15, or two of them for $24. The cleanser is $10 on its own, and the moisturizer, I think, is $12. So really fairly priced, and they're available to you through shop.drdustinportela.com. And if you guys have enjoyed this episode, share it with a friend. Leave us a 5-star review wherever you listen to podcasts. I'm Dr. Dustin. You can find me on all social media platforms at Dr. Dustin Portela.
And I'm Austin Lee. You can find me on most social media platforms at Austin Lee PAC.
We'll catch you on the next episode.